Dr. Mamawah Bourque, welcome back to Adultish Wines.
Oh, it's been way too long.
Whoa, I just sounded very doctoral. That was like so sterile wall of me.
Oh.
Don't you think? Dr. Mamawah Bourque, let's get into it.
Ooh. I mean, but it didn't sound terrible.
Okay,
I
good.
kind of just went with it.
You did. Welcome back.
Thanks. I'm so
Okay, so this is going to be like episode 120 something.
Ooh.
And you were here in episode 75. That's the last time we heard from you.
I'm so proud of you.
Ah, thank you.
I'm legit. Like, that's incredible.
You were here. Well, not here. We were at my home studio.
Yes, I was. And, you know, what's interesting is I think I read somewhere that, like, most podcasts, or maybe it was you that told me this. I don't make it very far. I don't remember.
Maybe it was me who said I'm in the top 3% of podcasters because I've gone over 100 episodes.
Yes.
Maybe that was me.
There you go. There you go.
Yeah,
Yes,
isn't that
that's
crazy?
Really great.
I mean, it's a large 3%, but yeah, I mean, and no shade to the people who do quit or something else comes up and they change gears and stuff like that. But yeah, some people, you know, it's only for a short time, not a long time, but.
Well, this is definitely your ministry.
Thank you. I love it so much. I'm so happy to have you back. Cheers. Let's get off on a good start. For anyone who hasn't listened to episode 75, definitely recommend it. And I don't think anything's necessarily going to be repeat, but we are going to be getting into, you know, kind of the misconceptions and the things that your craft, pelvic floor, physical therapy can help.
Yes.
You own Awareness Pelvic Health.
I do. Come see me.
Come see her. And I've been talking since episode 75 that I need to go see her, actually. And I was going to, but it just didn't work out with scheduling before this. But you just opened your new place.
Yes. And I'm loving it in Montrose. And the amount of sunlight that we still get because there's so many windows.
Love
I
that.
think it is therapeutic in itself. Because I feel like a lot of times we just say, like, let the sun hit you. Obviously, I'm indoors. We're indoors. But it's really, really important to just kind of be outdoors. And although I'm not outdoors, it gives the, you know, like, image like you're outdoors because there's so much sun.
Bright, cheery.
Yes. Very chic, but also very comfortable. It's not sterile at all.
No. Speaking of sterile. But I went to your open house. I guess you'd been open for a few months at that point, right?
Mm-hmm.
Back in October and November.
Uh-huh.
And a few weeks ago I went to your open house. And it was so cool. And I'm so proud of you.
Thank you.
That is so exciting.
Really excited. This was year 3 of our practice being open.
Wow.
Yeah. And so we're leveling up.
Yeah.
Yeah.
And you have other is it all pelvic floor therapists in the actual? Okay.
Mm-hmm. Yeah. So Dr. Janice in Kruma is also a pelvic floor therapist, also really incredible.
Mm-hmm.
And she is there, and myself, and hopefully I'd like because sometimes it becomes, I cut off my sentence there, but I think it's really hard to find pelvic floor therapists. And so a lot of times we get a lot more people booking, scheduling than our schedules can allot for.
Right.
But we try to have it to where people are not waiting longer than 2 weeks for an appointment.
Okay, that's pretty good turnaround time.
Yeah, because I know sometimes whenever people go to places, they've got to wait months.
Yeah.
It's just exhausting. So we want to make sure that our patients can get in, and then also our like new people can get in. So with that being said, I'd really like for this year to add another person.
Okay.
So yeah.
Growing. That's exciting.
That would be really good.
For anyone, and I just, there's probably so many people, I feel like pelvic floor therapy is still just like maybe undiscovered from so many. So can you give the listeners just kind of an intro to what you do in pelvic floor therapy? Just pretty basic, and we're going to be getting into specifics. Yeah.
So as a pelvic floor therapist, I work with all people, adults. There are some pelvic floor therapists that work with pediatrics.
Oh, okay.
But or kids. But I work with people that are experiencing either intimacy, sexual, pelvic issues, and that can come from bladder issues like leaking or difficulty emptying your bladder, and that's people that go to the bathroom over and over and over again and never really feel like they've emptied. But then there's also the people that leak when they sneeze, laugh, cough,
Mm-hmm.
and that's also a thing. And then there's some people that do both. Constipation issues, anal fissures, tailbone pain. We work with people that experience pain with sex, which we'll get into.
Yes.
We work with moms and people that are giving birth and after birth. If you've experienced a C-section that left scars or anything, we can, of course, address that, as well as push prep for people that are about to give birth, and so much more. Honestly, we treat a lot of things, but from a wellness standpoint, I think I said this last time when I was here, but it's really true. Like everyone that has a pelvis should go see a pelvic floor therapist.
So no matter your sex, right? It's
Correct.
not just for women. And I do
No.
feel like that's a misconception.
No, it's for all people.
Okay.
And one of the great things about it is we really focus on giving people the awareness of awareness.
Yes.
See what I did there? But the awareness of how to move their body. And I think that's the thing that not a lot of providers are able to do when it comes to the pelvis, and we're just the experts in that. Like, we're the experts in movement, physical therapists, that is, but we're also the experts in how to, from a pelvic floor therapy standpoint, how to teach you how to let go so those things are not a problem for you.
Okay.
Like, we're always trying to get our patients, we're just trying to empower them to not have to live with the symptoms that they've been experiencing,
right?
Reconnect with their body so they can live the healthiest version of themselves.
Okay.
So whatever that means, sometimes it doesn't just end at fixing this problem, but preventing it from coming back. So a lot of wellness and, return to what you didn't know you could be.
Right.
Mm-hmm.
Awareness Pelvic Health has been open for 3 years. Were you involved in a practice before then, or did you immediately go on your own?
No, I actually was with Viviana Coles.
Right. Oh, okay. So that
relationship therapy.
Okay. I just thought you were in the same building.
Well, at first we were together.
Okay.
And then we were just in the same building.
Okay.
Just restructuring and just kind of navigating the needs of, Houston relationship therapy and our needs. And so I think we obviously have stayed great friends and also great colleagues.
Right.
And before that, I was at the VA for 9 years.
Right.
And briefly took a left turn towards, I said left and did right. A left turn towards Methodist for a while.
Okay.
Hospital. And then I just jumped right into it.
Let's talk about, before we get into more like deep dive into pelvic health, let's talk about being a small business owner.
Okay. Oh my gosh.
Woo chee. Take a sip.
Exactly. Oh my goodness.
How do we get through the day?
Oh my gosh.
Obviously, I'm, what is the word? I'm projecting. Because I am like exhausted right now.
It is a lot of work. It is exhausting. Yeah. And I think I just came from like I think we talked about it. Like, I went to a business retreat in California a couple of weeks ago, and we took a deep dive into business. I was there like the bear was chasing me. Like,
okay.
It just felt all so overwhelming.
Yeah.
Like, oh my gosh, you got to do this. You got to think of this. You got to And I think I left with the understanding of like bite size. Like, just take chunks and do a thing and like put down perfection and just put it out there because people need the information, and it doesn't have to be tied up in a bow for people to get the information.
Right.
And sometimes I think it could feel that way. But I feel like it's really hard to put anything down. Like, it's always on your head.
Do you feel like you start tasks and then don't finish, like start several big tasks. So then you have 3 large things to do, and then you never get them done because you're working on 3 large things.
Yeah.
That's how I'm feeling right now.
You know what I did? Interestingly enough, this week, it's tax season, right?
Oh, Lord, yes.
I know.
Yes, it is.
And so I was like, okay, I had to do 3 things. And I was like, okay, my CPA needs this information. And then I also need to get this newsletter information out. But then I also so I was like, okay, maybe I'll just start this and I'll just do a little bit of it. And then I stopped and I just did the one thing and I finished it. And so it just kind of took okay, that thing is done. And I think
I need to do that.
That's the chunk. Like, just pick a thing, do that, and then move on to the next thing. Because I think that's what ends up happening. And then you go, I don't know if you do this. I do this all the time where I start on one thing. That one thing reminds me of another thing. So then I get started on that thing that it reminded me of, which reminds me of something else. And then I start doing that thing. And then I'm like, oh man, but you had to do this. And you just kind of do this like cyclical, what's the word I'm looking for? Non-productive.
Yeah. You're just kind of like treading water.
Yeah.
Sometimes it feels like.
Yeah. So I think the chunks are the secret sauce.
Okay. So you walked away from the retreat kind of feeling like you had a better idea of like how to move forward? Was it a pelvic floor?
Yeah.
Okay, retreat. Yeah. Okay.
So it's all pelvic floor therapists.
Nice.
Not all physical therapists, but all pelvic floor therapists.
What's the difference?
There's not, I think it's our education approach.
Right.
So occupational therapists and physical therapists tend to, can be in the field of pelvic floor therapy.
Okay.
But our education is slightly different, but we're both therapists that really focus on the body.
Okay.
And I don't like to like fall into what everybody else says about things like, oh, we're upper body, you're lower body. But historically speaking, in like the hospital settings and in outpatient settings, occupational therapists tend to work more on like fine motor skills. So like if you couldn't tie put a button on, or if you broke your finger and you had to do all this, like go back to writing,
right,
all the things there. If you're in the hospital and you can't use the bathroom anymore because you can't wipe yourself or tie your pants or pull it down, OTs would probably do that.
Okay. While
PTs would probably work on walking and like the more gross motor skills, and they work more on fine motor skills. So instead of upper lower, I think they get placed in that category because they tend to work on the fine motor skills more. Okay. But their understanding of like bladder, bowel, as it pertains to daily living activities, like going to the bathroom, sex, and all the things, that's something that falls in their space. So they tend to be there as well. Okay. But
nice.
Yeah.
But so that also just like broadens your, I guess, network of people that you get to work with or refer if, you know, you come across somebody who doesn't obviously, or you can't treat, or maybe they don't live here or something like that.
Yeah.
That's awesome.
Yeah. So
that's
kind of nice.
Yeah. Okay. We've started a new segment on adultish wines recently where we're doing wine versus fine.
Okay.
Is it a wine or is it fine?
Okay.
So we're going to start with when people don't RSVP. Is it a wine or is it fine?
Oh my gosh. It is so fine.
It's so fine?
Yeah.
Okay.
Yeah. Maybe because I'm African. First of all, Africans are notorious for not RSVPing.
Oh.
Sure, you know it's true. If you're African, I bet you anything you're gonna be like, yeah, it's true. They're just notorious for not.
So you have an event and you don't know if you're gonna plan for 60 people or 100 people, and that's just on you, babe.
You know,
on the host.
It is rough out here in these streets, but I will say that it's fine-ish.
Okay.
Can I say fine?
Okay, fine.
Yeah, adult-ish
yeah,
wine.
Yeah, yeah,
so I can do fine-ish. Okay. I would say that it's fine if you RSVP late. I don't think in this day and age it's fine to not RSVP.
Okay.
But I think
Eventually you got to get it in.
Yeah. But I think it is common in the African community not to RSVP and then just show up.
Who are you? Are you RSVPing or are you just showing up?
It depends on whose party it is.
Okay.
So if it's like my sister or my cousin, like I'm not, I'm going to be there. Like
Okay.
we're not going to talk about that.
Okay.
But if there was an event that like a wedding, actually, I forgot to RSVP to my But she called me and was like, hey, I didn't see your name on it. I was like, I never got it. I was waiting for it in the mail.
Yeah.
And she
but
was
now it's like through text message and stuff.
Exactly.
Isn't that crazy?
So she did that and I didn't even know. And so I missed it, but I would have definitely RSVP. But if it's a wedding,
okay,
like a dinner party where you're going to have to be somewhere, absolutely RSVP. But if it's just like something social casual, no.
Okay.
I might not RSVP.
Okay. Wine or fine, all-inclusive resorts.
Oh, fine.
Really?
Yeah.
Okay.
Yeah.
I don't feel buzzed at all-inclusive resorts with their alcohol.
Oh.
So it's a wine for me.
It's a wine?
Yeah.
Oh, interesting. I was going to ask you.
And the food is like never great.
Okay. It depends on where you're going.
Yeah, maybe I need to up my
I've done
status.
both. Like, great example. I went to Jamaica with some friends.
Okay.
And we stayed at a location where we kind of just paid. But it was like a Airbnb vibes. But everything was included with whatever we paid for. Right? So we had a chef.
Oh.
And a driver. And we'd wake up in the morning and be like, oh, we want to go to Negril today. And then be like, oh, sure, no problem. It was so nice.
Whoa.
Yeah, but it wasn't like crazy expensive.
Okay, that's not the all-inclusive I'm thinking of.
Okay.
I'm thinking of like no shade to like, the Rio or the Ryu in Cancun. It's like pay for what you get.
There's some places like, I don't know, I like Sandals.
Okay, I haven't been to a Sandals.
Yeah, and their food's really good.
All right.
Yeah, and I like not having to think anymore because I'm not a heavy planner. So that's why it's a wine. Yeah.
That's why it's fine for you.
Mm-hmm.
I guess I don't mind. It depends on if I'm in the mood to be at the resort the whole time or if I'm wanting to go out and adventure. Like all-inclusive resort, if I'm going to want to go out and adventure, that's fine with me because I'm already going to be out. Like, it's cheap enough.
Yeah.
I'll eat there if I have to, but like I'll go do fun things and eat at great, taco street vendors or things like that. But if I want to enjoy breakfast, lunch, and dinner, I don't know.
Yeah.
Okay.
I hear you.
Group chats, wine or fine? Group text messages.
I'm going to go with wine. I don't like them at all.
So sweet about it. I don't like them.
I also do not respond very well in them. Like,
okay.
I'm not a person that's going to be like, tap it in. I'm that person that like 6 days later, I'm like, ha, 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 that was funny. And everybody's like, what are you talking about?
You're late.
What is funny?
Yeah.
I'm definitely late to the party. And I also hate talking politics. I love talking politics, but I hate talking politics on group chats.
Yeah.
And because I just feel like your message could be misconstrued.
Well, also, I'm wondering what kind of politics are like. It's probably all just very like, oh my God, this happened, or oh my God, this happened, or did you see this?
Or like,
yeah.
Like,
well, also that would
people
just
saying the thing because then it's like annoying because I don't have the capacity to explain my thought process, and then it just like puts like a feeling internally, and I don't like it. So
yeah.
I just go,
Okay. Wine or fine? Skipping voting if you didn't know who to vote for.
Ooh, no, that is a wine.
Okay.
Pick your poison.
Same for me.
It's like, I mean, not
yeah,
that it's
choose,
poison, but like you just gotta choose. I don't. No, that's a definite.
Yeah, I mean, people fought for so long for so many different types of people to have the right to vote. So, I do agree with you.
Yeah, we're on the same page.
It was tough.
I would have left if you said fine. No, I'm kidding.
but it was tough. It was tough to hear. Actually, I had a conversation with somebody who I just love and respect so much, and they, before they got to that part of the conversation where they said they didn't vote, we were talking about just like the world and things like that, and everything that's going wrong, and and it was a really great conversation, different views, as it's what I do.
Yeah.
And then they said they didn't vote, and I was like, I wasn't surprised that it got to there by the end of the conversation, you know?
Mm-hmm.
And I kind of respected what he said,
Mm-hmm.
but I still
I want to know.
just very disagreed.
What was the
We don't have time.
Dang it.
We don't have time.
Next.
Okay, let's get into physical or pelvic floor physical therapy.
Okay.
You kind of said at the beginning for constipation issues or leaking or I think you said like really, you know, medical terms, but like peeing too much, too often, things like that.
Mm-hmm.
So if somebody's experiencing those issues, pelvic floor can help because why?
Because there are various ways you should be able to move your muscles or different ways you should be able to move your muscles. And sometimes that's the barrier to being able to do those things well. Like
to have the control.
To be able to like hold your urine in time to get to the bathroom. Also to shut the door so that you don't leak. Sometimes it's just like a
shut your
pee hole.
Okay, your
urethra,
pee hole door.
Yeah.
Okay.
Shut that door. But it's like a dance. Like working your pelvic floor is like learning how to move your body in a certain way and knowing the routine of what to do at what time.
And how do you diagnose? And I know it's going to be different for every single client. Even probably two different clients who complain about the same thing. I understand that it's going to be very specific to that person's body and whatnot. But how do you diagnose? It's internal.
Both. So I'm going to talk to you, and we're going to go over all the things that you've been telling me.
Okay.
Typically. Most of the time, I try very hard not to be biased, but most of the time, by the time you finish talking to me, I kind of already know what your pelvic floor is going to do. And I probably already know what you're about to do when I, do my assessment.
Yeah.
And then the next part is internal. Like I'm going to go and ask you to do things on my fingers, checking to see what your body does internally.
Okay.
And then whatever things you do, then at that point I could have a better idea of like, this is this problem. Like
you're asking me to do like things like flex
squeeze my finger, let go of my finger.
Interesting.
Push like you're passing gas. Cough for me. And I'm trying to see like, what does your tissue do? Like, is it moving at times when it shouldn't be? And then is it not moving when it should be moving?
Okay.
So I'm really looking like, okay, here's your pelvis. What is it doing whenever I ask you to squeeze my finger? Does it lift up too? Does it just stay still? When I ask you to lift my finger and squeeze, do you squeeze and then 3 seconds later you start letting go?
Right.
That's like, okay, you definitely have a little bit of weakness there, or even an endurance problem. But that might not be a weakness because you can't squeeze and let go, squeeze and let go, let squeeze. You just can't squeeze and hold it. So if you're having issues leaking, okay, we need to see how to make your tummy muscles work with your pelvic floor better. We need to make sure that you're using a good breathing pattern so that your muscles can do what they need to do at the right time. So it's just complex, but it's actually really simple. Like once you get it, it's not that complicated.
Yeah. I'm picturing myself even when I did physical therapy for all of the injuries that I've had, like, and they tell me to, I don't know, do something really simple.
Okay.
Like do a bridge or like, I don't know, like squat. And I'm like, it feels like such a weird thing to do. It doesn't feel natural or something. So I'm just like picturing myself.
It will feel kind of unnatural.
Yeah.
It feels, actually, most people, it's like tapping your head and rubbing your belly.
Yeah. That's kind of what I'm thinking.
Yeah. And it probably is that way for like the first 3 or 4 sessions, maybe even 6.
Okay. And then how do you feel like, okay, because as a woman, you're going to get your hopefully annual women's health exam, or is it at this point,
please do it.
It's annual, right? Or is it twice?
I think
every 2 years now.
You're supposed to get it annually, but you're not supposed to necessarily need a pap smear every year.
Right. That's like every 2 or something.
Yeah.
But like no matter how many times I've gone, never get used to the feeling of, being laid out on the table and having, someone putting something inside you.
Mm-hmm.
How do you combat that? Like,
That's such a good question.
yeah.
Well, we really try not for our clinic is not sterile. It doesn't look
No,
like
and it
your
is not.
traditional space. And we try to get, it sounds like counterproductive, but we actually try to get close. Meaning like if you were in my clinic, your leg would be right here, like on my lap as we're checking you out. Because the intention isn't for me to be so far away. It's like that pressure that just kind of like, me personally, I get close and we talk about it and we give you rest breaks because I can feel the tension if you're like holding up like this.
Yeah.
And then I'm like, okay, well, you're clearly not comfortable. So let me just move my hand and you're going to be okay. We also cover up the entire time. So even if I'm working on you, you have like my hand might be there, but I'm totally covered.
Okay.
So you can't even like feel like you're exposed.
Mm-hmm.
So it's almost like you're underneath the blanket, but we're working on stuff.
Okay.
Sometimes we use heat on the table so that people feel like warm and cozy.
Yeah.
Instead of feeling like
I'm like,
clammy.
yeah, that sounds nice.
Yeah, and I never start looking at your vagina. I'm always going to start looking at your breath. I'm going to talk to you the entire time, tell you what I'm going to do next. And is it okay if I do that? And I think that's part of the thing that sometimes people experience when they go to the to go get their, well woman or pap smear is they just go for it.
Yeah.
They're like, all right, clip that's up.
Right. And it's quick movements and put your heel up there and lift up and like
get your butt down.
Yeah.
It's very
transactional.
Yeah, it is very transactional.
Which is like, I guess I just okay, great. I'm going to go in and it's going to be quick. Yeah. Like I do know that, but I'm always like, oh God.
Yeah. I don't.
Okay.
No, it's going to be, it's intentional, not transactional. Like everything is for you to take it home and do the thing. So it doesn't feel like somebody's doing something to you.
Mm-hmm.
It's like somebody's teaching you something.
Okay.
That's the intention.
That makes sense.
Mm-hmm.
I like that. One of the things that pelvic floor therapy can help is pleasure with sex, also pain having to do with sex, right?
Yeah.
First of all, you showed up here and you said, "Oh my God,
I forgot my
clitoris."
I'm so upset, guys. I forgot my clitoris.
My producer was here with our mics and I looked at him and he's like, which is like happy that he knew what that was, happy that he knew what the word was.
We probably should have, if I would have had my clitoris, one of these days I'm going to bring my clitoris and be like, okay, tell me all the places.
And I said,
vagina,
well,
like
we do have 2 clitorises here, but it's not that type of show. We're not going to be out and about like that. But we really wanted to talk about pelvic floor therapy in regards to sex.
Yes.
So let's go. And I am so jazzed about this topic.
I'm glad you are, because that's definitely one of my favorite topics to talk about.
Okay, how do we start?
We just start. Let's talk about the clitoris.
Okay.
Since I forgot the clitoris, we're going to start there. So I think one of the things that I like to give education on is clitoral health.
Okay.
I think the clitoris is usually just like, people mostly see it. And in case you don't know what the clitoris is, it's like, well, no, not you, but I'll start there for you.
Yeah.
It's like a pea, size of a pea looking outer part of your vulva, which is the whole vagina area. It's not, the vagina is actually the canal. The vulva is the whole outer area. And it's this, at the top of the outer area, there's this little pea area, well, like pea-like sized tissue. And that tissue is kind of covered in most cases with like a hood. We call it the hood. And basically the hood should be able to move, and it exposes kind of the head of the clitoris, which is the outer part. But the clitoris actually lives inside the vagina, inside the pelvis. It lives on the inside. Okay. And so if you think of like a man's penis and testicles, think of all that, but inside.
Okay.
And then the head is just the outer part. So there's a lot of nerve endings, over 10,000 nerve endings. So that's a very heightened pleasure area.
I was going to say, if I don't come, I've never come with a penis inside me. I only come
with clitoral stimulation.
Clitoral stimulation. I was going to say clitorally?
Yeah. Clitorally. Yeah. Literally.
I literally only come clitorally. Yeah, clitoral stimulation.
Yeah. So that's, I was just talking to your gynecologist earlier, and
my gynecologist?
No, not yours.
Oh.
A urogynecologist.
Oh.
Maybe I talked to your gynecologist before. I don't know.
I was like, okay.
But I was talking to her about, I was talking to an audience about sexual health and all the things associated with it. And I think she mentioned like only 18% of people actually orgasm with vaginal, with penis and vagina sex.
Yeah, without any other stimulation.
Correct.
Right.
The clitoris is it's the only organ in any body, right, that is solely responsible for pleasure. Like, it doesn't have.
I didn't know that.
All other organs in your body have like a function,
a purpose,
like a purpose, another thing that they're responsible for. That one is solely for pleasure, and it's only in the female because.
Oh, thank God mine works.
Yeah.
Thank God mine works.
Because when it's not, it's really uncomfortable.
Oh my God. Okay, so continue on.
Yeah. So I think one of the things is really understanding how to, make sure that you move that hood out of the way, like during a shower, move your hood back, because I'm not too worried about like what they call smegma, or just kind of like discharge or build up around the clitoris, but more so just because if that hood doesn't move out of the way and the clitoris actually getting like blood flow and all the things, it could shrink, it can get smaller in size, and it needs blood flow. Like, every organ in our body needs blood flow. And if it doesn't have blood flow, it's not going to really function at its optimal level. So people that are like, I'm having a difficult time orgasming, I think that if you could spend some time in foreplay a little longer, that could be very helpful for your sex life. I think people just, a really great therapist once said, like, sex is not, what did she say? Sex is more like Golden Corral and not like Chili's.
Oh my God.
I really like that. It was perfect. Way to go, UC Law, UC. She basically was like, you have to, there's more than one way to like explore sex.
Okay.
And a lot of people think like, oh, penis and vagina, that's it. Or it has to be like digital stimulation,
right,
like your fingers or fingering somebody or anything like that. But
yeah,
there's a lot of different things you can do. So I think it's really just about educating people on like what ways you can. And so addressing the clitoris to make sure that it's got good blood flow is very important. Okay.
And that could be being done through
sex.
But before.
Oh.
Right?
Like foreplay.
No, just like on your own, like how you said, like showering. Like,
yeah,
you need to be like paying attention to your clit.
Yes.
Before you need your clit.
Exactly. Yes. So check it out. Take a look. Take a mirror. A lot of people don't look down there.
Yeah.
Looking down there could be very helpful. Also looking for skin changes. Like if you've got like a really irritated area on your skin, there is like a dysfunction or like a disorder, lichen sclerosis, which is basically where it's where the skin of the outer lips or the opening of the vagina can sometimes have scarring. It can be really itchy. When you look at it, you don't see anything, but it's really itchy, and it can cause a lot of cracking of the skin when if the skin breaks down, it can be really bad. And sometimes people miss it, or they go to the provider and they're like, I don't see anything, and they move on.
Right.
But it's a real thing that if you're not looking, you could miss, and it could just progress into things that require surgery and just a lot of unnecessary things.
Okay.
Yeah.
Pain with sex.
Uh-huh.
How does pelvic floor help that?
Yeah. So I would say pain with sex is an umbrella. So because some people have
too large of a term.
I mean, it is a large term, but it's good enough.
Okay.
Like if you say I have pain with sex and you come see me, we're going to break it down. I'm going to ask you, is it with penetration when you first start? Is it with deep penetration? Is it with an orgasm? Is it with just clitoral stimulation? Does it happen all the time? Like, I'm going to break it down. Does it happen in certain positions? Because they could all mean very different things. So pain with sex for some people, it might mean that when they try to have, their partner might say like, oh, it feels like I'm hitting a wall. Like I can't get any further in. And so in those cases, I'm going to check your outer pelvic floor muscles to see if maybe you're like pulling them up, or if they just don't have the motion to like get out of the way. Either one of those things, we're going to move into a certain way for your treatment plan. If you're telling me it's with like doggy style, I'm going to take a look at the muscles that are, likely to be applied pressure during sex and doggy style. I mean, I'll look at everything, but I'm not going to miss those.
Okay.
If you tell me deep penetration, I'm going to look at muscles that are probably going to be further back.
Right.
And see if there's any tenderness there. If you tell me you have numbness or just pain on the like burning sensation on your labia or your lips, I'm going to take a look and see if when I move that tissue, it does something, like it irritates you or it feels like different on one side versus the other. So it just depends on what is going on with you. But I think that the bigger picture is like people think, so pain with sex, unwanted pain with sex. I will say that because some people.
Okay, true.
Unwanted pain with sex. People just associate like, oh, that's who I am.
Yeah.
Yeah, and they just kind of go along with it, but it's really not that.
I've had many friends, or I don't want, maybe not acquaintances, but many people that I know in conversation have just been like, oh yeah, sex is anal, but like I do it.
Yeah. They should it. I mean, not that they shouldn't do it, but
there could be, address it. There could be some help.
Yeah.
It could be enjoyable, pain-free.
Pleasurable, very. Pain-free. It happens all the time in our clinic. People come in with pain and they leave without it. And it's fantastic to hear them say, oh my gosh, it didn't hurt. And I'm like, great. And now you know what to do and you can continue that moving forward. Yeah. Or we give tips and tricks to lubricant education so that you use the
real quick, at my 100th episode live show, I had Dr. Viviana Coles on as one of the guests, and she was really against spit. Do you remember?
Yes, I remember that.
Really against spit lubricant.
Yes, I remember her saying
Feelings? Thoughts? You agree?
No, I actually disagree.
Okay. Oh, sorry, Dr. V.
Sorry. I disagree because it is a lubricant. Oh, sorry. It is a lubricant. And I think where it could get the ick is because in some cases it might be somebody else's spit.
Right.
And it's like,
I think that was what she was saying.
Yeah.
Like there's other ways to do it, less bacteria.
I don't think it's the worst thing you can do. I think honestly, there's some brands that are in the store that are very common that people get every time that are like a few letters or something like that.
That are bad?
That are not good for you. They dry up your vagina during sex. If you ever feel like it's raw and it's just getting more and more raw, it's just sucking all of the moisture out of your vagina. No joke. Do not get that.
Oh my God.
Yeah. So you have to get a lubricant that thinks of the vagina in mind. So the pH of the vagina needs to be between, I think it's like 4.5 to, no, 4 to 5.
Okay.
Closer to 4, 3.5.
Okay.
You want it to be, but you're not checking the pH of your vagina, but that's naturally what it should be. So
right.
your lubricant should not interrupt that pH.
Okay, with that said, and let me know if this is not your arena, how do you feel about like certain pH balanced soap specifically made for vaginas? Like, because there's kind of, I mean, for a while it's been going around like, don't use soap because that disrupts your natural pH.
Yeah.
And then there's soap made specifically with pH. Which one are we supposed to use?
Yeah. So
is it different for per person?
Well, I think what it is like the pH there when they're saying it's pH balance, I think what they're trying to explain, and this again might be a little bit out my space, but it sounds like what they're trying to say is the pH, it's balanced for the vagina. So it's like a balance with what the vagina's pH is. So it's not going to aggravate your tissue. Like it's like for sensitive skin. It's like the same concept.
But that's
right?
You think that that's okay to use?
Yeah, I don't. I think less is more. So like anything that you would use on your face would be okay on the outside. I think where people are getting confused with like don't use soap is they mean inside. Like sometimes people like really try to open up and like, you know, really clean and they think they need to. And then douching is another thing people think they need to do, and it's not okay.
What is douching?
It's like, it's not as common now, but it was really common like, I don't know, in the 80s or early 90s or 70s. It's like basically they would squirt some stuff internally to wash out the vagina.
Not needed.
No, because the vagina has its own, it has bacteria that it's supposed to be there that helps, good bacteria. And it's very non-selective. It just washes everything out. And then when people are getting things like BV and yeast infections,
bacterial vaginosis and yeast infections. Yeah. I've been the victim of a yeast infection, and Lord, let us pray.
Yes, those are not great at all. They're like the worst.
And I got over the counter, you know, the Monostat, and turns out I was allergic to an ingredient in there. And it wasn't good. You know, it was one of the most painful experiences of my life.
Gosh.
But yeah, like now I do everything. And maybe this isn't your arena, but like do you recommend as far as vitamins or things for people with sex? Is this not your arena?
No,
tell me.
I would usually defer to the gynecologist.
Dr. Viviana or the gynecologist?
Yeah, or urogynecologist.
Okay.
Because they can prescribe things and really assess what it is that's there. So like for instance, if your pH is like if they do their swab and their swab comes out positive for yeast, like I'm not checking for like labs at all. So I'm not going to say, oh, you need this. There are things that are really good for your body, like nutrient wise, like sweet potatoes are really good for vaginal health. Okay. Like orange fruits and vegetables are good for your vaginal health.
I'm happy that you said sweet potatoes are orange, because that's a battle that I fight with somebody, and I'll have to show them this part of the episode.
Well, in my opinion,
they are.
Yes,
okay. Yams are yellow. Sweet potatoes are orange.
Yes, sweet potatoes are orange. Oh, okay.
Yeah, there's a difference.
You're right.
Thank you.
There are some purple sweet potatoes though.
Yeah, and I did find that out in my Google search. Okay, we've covered a few, but I wanted to talk quickly about some misconceptions of what you may or may not need pelvic floor therapy for or do to help. That it's reactionary only. Like you can go before you have a problem.
Oh yeah.
And it's recommended.
Yes. To be preventative, I think it's good for everybody to connect with that part of their body. When's the last time somebody talked to you about your pelvic floor?
Never. I mean, the last time you were here on my episode. Yeah, lucky enough for me.
Yeah, you're a unicorn.
Yeah.
There's a lot of people that never get that. And so to me, just imagine any part of your body that you didn't know like existed or how to make it function. And like we pick up a glass of wine or coffee every day and we know what amount of pressure we need in our hand to be able to bring it to our mouth. But if I ask you to pull up your pelvic floor and then release it fully, most people would have a big question mark over their head. Like, I don't know if I released it.
Right.
They might feel it contract, but they don't know if they release it. They don't know what that feels like. You know, they don't know how to squeeze and then cough, and they're not taught those things. So I think just generally speaking, it could be great for preventative.
Okay. Kegels are not the Bible for pelvic floor health.
I definitely made a double chin on that. Yeah, no. Honestly, most people that I see have the opposite. They don't need to be Kegeling. They are raised pelvic floor that doesn't let go, that is really tender, that needs to release. And so I wouldn't say that if you have a leaking problem even that you have weakness. Like just because somebody tells me, oh, I'm leaking, it's likely not.
Okay.
I'm gonna move my knee.
Get comfortable.
Oh my gosh.
Uh-oh, is it cramped?
Yeah. Oh my God.
Another one is I think that maybe people think that it's really only for women, pelvic floor health or therapy.
No, it's for all people. Men have pelvic pain. Men have erectile dysfunction, so they can't get their penis to stay erect, or it's kind of erect but not fully erect, which is what we call hard soft, like a hard soft penis. And so, you know, we're going to take a look at what's going on with that. People have testicular pain, like cyclers, tailbone pain. People get hernias, and they just don't know how to use the right pushing mechanics. People after they've had prostate surgery can have a lot of leaks, and that could be problematic. Constipation, pooping issues. Not knowing how to, like, there's some people, there's a thing called defecation dyssynergia, which basically means like they don't have the coordination when it comes to pooping, so they never really empty their bowels. They don't ever.
Oh no, that sounds awful.
Yeah, because when you can't poop, you just probably are feeling like miserable.
Luckily, I'm just like a really healthy pooper, but when after surgery, a few surgeries that I've had.
Yeah, because
constipated for a few days, and it's just like I am really upset.
Yeah, you're miserable.
Yeah.
Yeah, and so just imagine not ever having that coordination.
I feel so terrible.
Yeah.
Okay, so go seek pelvic floor therapy. Yeah. Advice, help.
Our trans community, right? And so you have people that if they've had a vaginoplasty, which is basically like the procedure to have a vagina, and so with that, I mean, you're going to have to know how to use your muscles for pelvic floor before surgery and make sure you don't have any issues, and then after, that's another community that might need it. People that have vaginismus, which is like when the muscles don't ever open, so they can't even have penetration happen.
Oh no. Yeah. Okay. But that can be solved.
It can be solved. All of these things can.
That's exciting.
Yeah.
I'm saying oh no dramatically just because some of these things I never have heard of that word.
Yeah.
Or that term. So.
Yeah. So that's usually people that it could be for one or two things. Like maybe you had a sexual trauma or any kind of trauma, medical trauma after birth or whatever, and you can't you guard or protect, so that would be like more secondary vaginismus, meaning like the tissue really could move, but something emotionally makes you like guard and protect every time. And then there's people where the tissue just really doesn't open as easily. And so those people, you might do something a little bit different than you would somebody else. Like, yeah.
Okay. What's your wine of the week? We're there already.
We're already at the wine of the week.
Time flies when you're talking about clits.
I know. My wine of the week. I had it and now I've lost it. I think. Oh man, there's a lot to whine about these days in my.
I know the year has started. My personal year has been okay, but like the world's year, California's year, the world, the United States year. There's a lot going on.
Yeah. And it's been emotional and stressful. So I would say, but I'm going to keep it light.
Okay.
My wine of the week has to be clothes just not fitting.
Okay.
That's my wine of the week.
Okay.
It's
Talk to
really
me.
Annoying.
Like, okay, I think I see where you're going with this. So you like trying on clothes at the store that are your size.
No, clothes in your closet.
Oh.
Because your body changes in all the stages of your your cycle, and sometimes you feel like super bloated and you're like, ugh. Like,
why can I button a jean one day
and then the next week you're like
2 weeks later I can't get it over my ass.
Yeah. And then you're sitting there going, did I gain weight? But then you look at the scale and it's not really any different.
Yeah.
It's kind of like
and can we talk about, like, on that note, why a size 10 in one pair of pants at a brand is not the same?
Yeah. And then in some places you just feel like crazy heavy, and then in other places you're like, oh my gosh, look at that, that's really cute, that was a small. Yeah.
That just happened to me. I bought a dress in a large and it fit me perfectly. I bought another dress in the same size. It was a long sleeve, not short sleeve, and it's supposed to be like a tight dress.
Yeah.
And it was not tight.
Fabric.
Which is like cool. I'll go get a medium, but annoying.
It's like, that's really kind of annoying because you can't really ever tell. But I just say, just try on different things, and that's what I did.
Okay.
That's my wine of the week. There was one that was even better than that.
No, but I feel that. Where can the listeners find you? Your information will obviously be in the show notes, but.
Yeah, so you can find me at Dr. Mamawah Bourque. You can find me at Awareness Pelvic Health. You can go to our website. We like to do a lot of speaking of community events, we have one coming up. It's called, we did it last year. It looks like Coochie and Cocktails.
Oh, yeah. But it's couché, right?
Yes. And so we did that last year. It was such a hit.
Okay.
So we're going to do it again this year at Wild Coffee Shop in Montrose.
Oh, I love Wild Coffee Shop.
Yeah.
Okay, fun. What's the date on that?
February 20th.
Okay.
It's free for the community.
Perfect.
And you just come, and there would be, well, don't come, but come. Well, you can come if you want. But you should join us on February 20th at 7 p.m. at Wild Coffee Shop in Montrose.
Okay.
And it will be an open panel talk on sexual dysfunction and actually on sexual health, intimacy from a pelvic floor standpoint.
Okay.
A woman's health standpoint, so like a provider, and a mental health standpoint. So I'll be there. Dr. Janice will be there. Dr. Viviana is going to be speaking from a mental health standpoint. And then Latrice Mason, who is a nurse practitioner, and she has her down there practice. And so she's going to be talking.
Oh, cute.
I know. It's cute, right?
Yeah.
On like women's health things, like from a medical standpoint, like what things you could do. So I think if you have questions, you're going to have so many providers there that can really provide some really good information. Have a drink or not, a cocktail or... And
if people are not from Houston who are listening, they have a question, maybe you can't service them, but DM. You
can also always find pelvic floor therapists on the Academy of Pelvic Health. So they have a website that you find me a PT. Pelvic Guru has a list of pelvic health therapists. The Vagina Rehab Doctor has the Women of Color Pelvic Floor website that has tons of pelvic floor therapists in your area. But you can also just DM me if you have a question, and I will, if I can't answer it, I will put you in the right direction.
Okay, awesome. Thank you so much for coming back.
Thank you.
Dr. Mamawah, you're amazing, and
you are
full of knowledge, things that I didn't know still from the last episode, so that's good and helpful.
Well, good.
Yeah.
I was hoping maybe we could talk about it. I'm just really sorry I buffed my clitoris. really sorry.
Me
Because
too.
man, you guys, one of these days, just follow me. I'm
Just
gonna show
whipping
you
out your
all-
clitoris.
Maybe not mine. We're not doing that. We're not going there. But we
Okay,
will
cheers.
definitely show you my model.
Bye, Winers. See you next Thursday.